Hi, Dawn. I really enjoyed reading through your assignment. I felt like you put a lot of effort and hard work into understanding and researching about your client's diagnosis and medications. There are multiple good things that I've noticed with the homework you submitted. First things first, I liked how you kept the client's name confidential here. So as you can see, you use the acronym GG, so there's no indication of your client's actual name throughout your assignment. I liked how you laid out the diagnosis in your assignment, so I know what research you're supposed to do in regards to your client diagnosis. So by you listing it here made it easier for me to understand what medical history your client has and how we can start connecting the dots between diagnosis, medications, tests, and so forth. So you did a great job doing that. I really enjoy the layout you use when creating this document. So, for example, you wrote down retention, but then you divide it further into pathophysiology, modifiable risk factors, non-modifiable risk factors, what are their signs and symptoms that they present with, um, and also what are some nursing management, some lab and diagnostic tests, and what are medications they usually use in regards to those diagnoses. So I really enjoy the layout, and I really enjoy how you reference from the textbooks as well. So I know your research that you've done is from a credible source. Just going back here to diagnosis, I like how simplified you provided the pathophysiology. You've provided in layman's term and something that's easy for you to understand. Because I know in the textbook sometimes you can go for pages and pages explaining patho of certain diagnoses. So by you understanding and shortening it, um, in your assignment here. Um, it's a great reference tool for you to look at whenever you need to refer back to your homework here in regards to your client's diagnosis. What I also enjoy is also how you explain medications. Sorry, just scrolling down here. Okay. Again, the layout is excellent. It's an easy reference guide for you whenever you're providing medications to your client and you are unsure about what you're giving or the action of the drugs or the side effects of medications. Just by simplifying your medications on a single page like this, makes it easier for you to reference back. Okay. Um, your medication profile has everything I expect of a student. You have what the classifications, it belongs to the action of the drug, okay? Why your client is taking it, what's the safe dose, um, what is the dose that your client's taking, so we know that it falls within that range. And I love how under side effects, just like the drug book, you list it in red, the severe side effects of the medication, and then underline the most common side effects that a client can experience with this medication, which is great. Also, for nursing consideration, I like how you separate it into what kind of assessment nurses need to do prior to administering the medication and during and after. And also enjoy the fact that you've written down the type of teaching that you should provide to your client, especially if it's their first time taking the medication. So I thoroughly enjoy reading the medication research you provided here. And again, your reference is excellent. Davis Drug is a credible source and something that we often use as a reference in the hospital setting. Okay. Looking at your holistic nursing assessment, going by body system, it's very wholesome. And you did collect wonderful data on your client when creating a head to toe assessment. So well done on that. Okay. Your data collection sheet, excellent as well. You did have their level of intervention for your client, what kind of allergies, right? And what are their daily routines, right? So you're able to fill out this information sheet quite well. When it comes down to nursing care plan, okay, reading it as well, um, you did demonstrate a good understanding of how to create an actual and potential nursing care plan with the rationale, with the plans, and how you're going to evaluate. So here as well, you did a very, very good job. And again, the reference from the textbook as well. It's much appreciated. As an instructor, I am here to help guide you and make you a stronger nurse. Overall, your research was well done, but what you could have added to just make this even better and to help guide you when you're out there in the clinical setting is the addition of, sorry, let me just scroll back, just under your diagnosis, just if you added diagnostic treat or sorry diet sorry diagnosis treatments that doctors will order, it would probably make this so much better. So for example, let's say your client's having a myocardial infarction. Another name for that is a heart attack. With the research, right, you'll understand that doctors will usually order ECG, troponins, we'll order nitro spray. We'll get you to do blood pressures, right? Just knowing that information, when you call the doctor, right, and you're suspecting one of your client is actually having a heart attack, you can actually suggest that to the doctor. Knowing from the research, what are the recommendations, right? So just adding that here will just help you in the long run when you're talking to doctors. So it's just a tad bit addition here that would further make this research as a great reference point for you to go back to. Um, Overall, it's well done. There's not much I can really recommend besides adding diagnostic orders from the doctors. Also, what might also help you down the road too is just under, sorry, specific lab and diagnostic tests. If you added the preparation needed, sometimes that can help you too. So, for example, MRI. We know that anything that's magnetic, you want this your client to remove. So any type of jewelries. You want to ask the clients if they've had any metal inside their body, things like that, before taking the actual test. Just knowing that information when you're out there in the clinical setting, you can actually prepare your client better just by knowing ahead what to expect. So just a little tad bit of additions to your research just will help you down in the long run here. Okay, but overall, well done. I'm very impressed with the work you've provided here.